Good afternoon. Thank you for coming this afternoon. Last December, I announced our plan to conduct a province-wide review of private and community ambulance operators with a focus on staffing and payroll. That action was a result of concerns related to ambulance availability and staffing across the province. So on behalf of the 4 regional health authorities, Grant Thornton was engaged to complete the review. I'd like to thank them for their work over the last couple of months. The information that was collected was financial in nature and related to compliance with contractual arrangements. It included ambulance staffing lists, timesheets and payroll records covering a 3-month period from July to September of 2017. The goal of the review was again to determine the level of operator compliance with their contracts. These contracts, negotiated and signed with operators, provide a level of government funding based on a required number of staff and wages to be paid to those staff. The results of this review are concerning. What it clearly shows is that some operators are not meeting their staffing commitments or paying agreed upon wages, and yet they are retaining their funding. To be more specific, Grant Thornton reported the following. 15 out of 47 ambulance operators, or 32%, were non-compliant in delivering minimum payroll requirements. 36% of ambulance operators, 36 out of 47 ambulance operators, or 77%, were non-compliant in meeting minimum staffing requirements, and 8 out of 47, or 17%, did not meet either requirement. We accept all of the recommendations made by Grant Thornton and will begin immediate implementation of those recommendations. So immediately, we're asking the Office of the Controller General to investigate any potential risk of fraud as outlined in the province's fraud management policy. We're immediately directing Grant Thornton to conduct forensic audits of 7 operators who are non-compliant with over $25,000 worth of funds unaccounted for. We're also going to engage Grant Thornton to conduct monthly monitoring of operators, and we're directing them to work together to ensure a clear, transparent data tracking process. And finally, we're going to set up a new internal audit group which will actively monitor operator contract compliance on a monthly basis to ensure services are staffed appropriately and all public funding is used for its intended purpose. Furthermore, over the summer and fall, we'll be working to introduce a new electronic record keeping and submission system to ensure transparency and operator compliance. We're going to review the location of ambulance bases to ensure they are meeting demand and need. As you remember, this is a financial and contractual audit, not an operational one. Furthermore, we're standing by our commitment made in the way forward to introduce a central medical dispatch system that will also increase transparency and response times by tracking all ambulances in real time. And finally, this fall, we intend to introduce new emergency medical services legislation in the House of Assembly to govern the entire ambulance and paramedicine sector. We have provided notice to all operators that we will not renew the current ambulance operator agreements which expire September the 22nd this year. Our intention is to continue to partner with ambulance operators, and the new agreements will fully reflect the recommendations made by Grant Thornton. Going forward, we will be following the new fraud management policy for core government employees, officers and contractors. This came into force on June the 14th of this month to ensure appropriate investigation and reporting of incidences of non-compliance. I want to close by stating that maintaining the integrity of our road ambulance service is paramount. We want people in communities to know that they have a service they can rely on in case of an emergency. Once again, I'd like to thank Grant Thornton for their work. We're committed to implementing all the recommendations to ensure we provide a responsive and reliable service for the people living in this province. So thank you very much, and I'd like to open the floor for the media to ask any questions at this point.